Good morning, students. In previous class, we discussed about fat soluble vitamins, vitamin A and vitamin E. In today's class, we discussed about remaining fat soluble vitamins, vitamin D and vitamin K. So, come to the vitamin D. So, we will discuss vitamin D in these headings: chemistry, RDA, sources, metabolism, functions, deficiency, and toxicity. So, come to the chemistry of vitamin D. Vitamin D is a sterol. It contains steroid ring. It is cyclopentanoperhydrophenanthal ring, which is present in cholesterol. So, there are two provitamins forms of vitamin D are there. One is ergosterol, which is plant source. Another one is 7-dehydrocholesterol, which is animal source. From ergosterol, vitamin D2 is formed, that is ergocalciferol, whereas 7-dehydrocholesterol gives vitamin D3, that is cholecalciferol. So from ergosterol, vitamin D2 is formed, whereas from 7-dehydrocholesterol, vitamin D3, that is cholecalciferol is formed. So this is the structure of ergosterol and 7-dehydrocholesterol and their forms to vitamin D2 and vitamin D3. So come to the recommended dietary allowance. So how much we have to take for daily vitamin D? So in children's pregnancy lactation, 200 to 400 international units per day, whereas in adults 200 international units per day. So more than 60 years of age, so vitamin D requirement is increased to 600 international units per day. So what are the sources of vitamin D? So the main source of vitamin D is we can get from sun. So the body itself makes vitamin D when it is exposed to sun. So what are the other food sources are cheese, butter, margarine, fortified milk with vitamin D, fish and fortified cereals and fortified food sources of vitamin D. Next, so after we taking, so when we taking, there are two forms, vitamin D2 and vitamin D3. So one is plant source, one is animal source. So it is absorbed in upper small intestine of GI tract, which requires bile salts, and this absorption into the blood along with the lipids. So in the blood it is transported with the by binding to vitamin D binding globulin or vitamin D binding protein to the various tissues like liver and other organs. So when these provitamin forms are entered into the body, which they ultimately transform to the active form, that is calcitriol or 1,25 dihydroxycholecalciferol. That is the active form of vitamin D. So this is a pathway how it is activated. So here cholesterol. So cholesterol, this is a formation of 7-dehydrocholesterol, which is a enzymatic reaction. Then this 7-dehydrocholesterol, which is present in the epidermis of skin, when we expose it to sunlight, the ultraviolet present in the sunlight will convert this 7-dehydrocholesterol to cholecalciferol. Okay, so what that is vitamin D3. Then vitamin D3 is transported to the liver by binding with vitamin D binding protein, and in the liver it is again hydroxylated at the 25th position to form 25 hydroxycholecalciferol. This one is 25. So here again hydroxylation occurs. So the enzyme is 25 hydroxylase, which requires molecule of oxygen cytochrome P450 NADPH as a coenzyme. Then 25 hydroxy cholecalciferol. This is the storage form of vitamin D. Then this 25 hydroxy cholecalciferol again transport to the kidney, where it is again hydroxylated at the first carbon. So again OH group is added. Okay. So the enzyme is 1 alpha hydroxylase in the kidney. This is the active form of calcitriol. The 3 hydroxyl groups is added. So this is also called as calcitriol. So 25 hydroxy cholecalciferol is called as calcitriol. So regulation of vitamin D synthesis or active form of vitamin D. It is regulated by the feedback inhibition by this active form, that is calcitriol, by inhibiting the enzyme 1 alpha hydroxylase enzyme present in the kidneys, and also parathyroid hormone and serum phosphate levels and serum calcium levels. So serum calcium levels, like whenever the calcium levels are decreased, that is hypocalcemia, leads to marked increase in the alpha hydroxylase activity. So decreased calcium levels will increase the activity of 1 alpha hydroxylase enzyme present in the kidney, so which require parathyroid hormone, that is PTH, to increase the synthesis of vitamin D. So functions of vitamin D. So the main function of vitamin D to regulate the plasma calcium and phosphorus. So it acts in different organs like intestine. So in intestine increases the intestinal absorption of calcium and phosphates by increasing the synthesis of calcium binding protein. So this vitamin D, that is calcitriol, increases the synthesis of calcium binding protein, and which bind with the calcium and phosphate, which will increase the absorption of calcium and phosphate. So in the bone, so action of calcitriol on the bone, it increases the mineralization of bone by increasing the activity of osteoblasts, which is the cells present in the bone, and calcium, and deposit as calcium phosphates, thereby increase the bone formation and bone remodeling also. So action on kidney, it increases the reabsorption of calcium and phosphorus and decrease excretion of calcium and phosphorus, that ultimately increase the calcium levels in the blood. Here you can see, so whenever the plasma calcium levels are decreased, so it stimulates the parathyroid hormone and ultimately increase the activity of calcitriol, that is vitamin D. So vitamin D act on different organs like bone, intestine and kidney. So in bone, calcium is mobilized and increase resorption, whereas in intestine increase the calcium absorption along with phosphorus, and in kidney, that is renal, calcium is increased reabsorption is occurred, that ultimately increase the plasma calcium levels. That's why the calcium levels is regulated in the blood. So what are the other functions of vitamin D? So vitamin D acts as modulator of immune response. It increases the immune proteins synthesis, and also vitamin D supplementation, which is beneficial in steroid resistant asthma patients, and also pancreatic cells requires vitamin D for their functions. So vitamin D normal values. So optimal concentration, that is greater than 30 nanograms per ml, whereas insufficient that is 20 to 29 nanograms per ml, whereas deficient is 10 to 19 nanograms per ml. So 10 nanograms per ml or less, which is severe deficiency. So what are the causes for vitamin D deficiency? First is inadequate supply through the diet, and even though we taken in the diet, so impaired absorption of vitamin D in the intestines or gastrointestinal tract, and impaired production of 25 hydroxy vitamin D3 in liver, any liver disorders, and impaired production of 1,25 dihydroxy vitamin D3, that is any kidney problems. Then resistance to effect of 1,25 dihydroxy vitamin D3. So vitamin D deficiency leads to the rickets in children and osteomalacia in adults. So causes of rickets. So we already discussed in vitamin deficiency. So nutritional deficiency like vitamin D take lesser intake of vitamin D, and any gastrointestinal absorption defects like chelators of calcium, phytates, oxalates and phosphorus, and antacid abuse that leads to the reduced dietary phosphate binding and also calcium binding. Next, gastrointestinal absorption defects like post gastrectomy. So next, any biliary diseases that reduce the absorption of vitamins, and any liver diseases, and renal tubular defects, renal osteodystrophy. So come to the features of rickets. There is a delayed milestones in children, and delayed closure of anterior frontanellae in the skull, and delayed dentition, that is next deformities in bones like bow legs, and decreased serum calcium levels. So what are the bone deformities in rickets? That is craniotabes, means softening of cranial bones, and deformities in skull bones, and frontal bossing, and rachitic rosary, pigeon chest, knock knees and bow legs. So here frontal bossing, you can see in the picture there is a frontal bone is protruded to front, that is called frontal bossing in children. Here you can see here these are bow legs, characteristics of rickets. So when they are growing, vitamin D deficiency leads to the bone abnormalities like bow legs. So this is a rachitic rosary, are called beaded ribs, which is a characteristics of rickets. There is a, you can see like a beaded like appearance at the costochondrial junction of ribs. This is a pigeon chest. Due to the abnormal bone deformities in chest region, this leads to the compression of these bone ribs and leads to the pigeon chest. This is a Harrison sulcus. You can see here, this is a Harrison sulcus due to the diaphragmatic muscles which drag the sternal muscles and ribs, that leads to the groove like depression, that is called Harrison sulcus. So other forms of rickets, that is renal rickets, which is a secondary to the hyperparathyroidism. When the hyperparathyroidism occurs, this is a renal rickets will increase the rickets. So it is associated with the any renal damage, that will impairment in synthesis of calcitriol, that is the deficiency of 1 alpha hydroxylase enzyme, and it leads to persistent hypocalcemia, means decreased levels of calcium is present. Even though we give vitamin D treatment, there is hypocalcemia is present, that is renal rickets. So renal osteodystrophy, this is the another rickets where renal parenchyma is lost, that is renal tissue, kidney tissue is lost or diseased. It is unable to form calcitriol, that is the active form of vitamin D, and that ultimately decrease the calcium absorption. Hypocalcemia leads to the increases in parathyroid hormone synthesis, which act on bone to increase calcium levels in blood. Consequently, there is excessive bone turnover and structural changes and bone deformities. So that's why this condition is called as renal osteodystrophy. Hypophosphatemic rickets. So deficiency of renal tubular reabsorption of phosphate, supplementation of vitamin D along with phosphate is useful. So vitamin D resistance rickets like in Fanconi syndrome. In Fanconi syndrome, deficiency of renal tubular reabsorption of calcium, bicarbonate, phosphate, glucose and amino acids. So when they ask vitamin D deficiency, you should write vitamin D deficiency abnormalities like in children's rickets and in adults osteomalacia. Okay, no need to write these different types of rickets, just you write the what are the rickets when it is occurs and different like bone abnormalities. When they only ask rickets for 5 marks, you should write these different forms, otherwise no need. So coming to the osteomalacia. So in adults, vitamin D deficiency leads to the osteomalacia. So what are the causes? So mainly in adults, inadequate exposure to sunlight and inadequate dietary intake of vitamin D. So what are the features of osteomalacia? So whenever the vitamin D is decreased, that is a vitamin D required decrease, that leads to osteoporosis and demineralization occurs mainly in the backbone, that is spine, pelvis and lower extremities, because of there is low serum calcium levels, that leads to increased bone resorption from the to normalize the calcium levels in the blood. So there is a osteoporosis, and that leads to increased softness of and susceptible to the fractures. So bowing of long bones. So these features mainly seen in adults more than 60 years. So they are more prone to the fractures. Here you can see bowed legs in the middle-aged man with osteomalacia, that is nutritional vitamin D deficiency, which is malformation of skeleton. Here you can see spine is deformed due to the vitamin D deficiency. So what are the other deficiency features of vitamin D? There is a vitamin D is required for insulin secretion. Whenever vitamin D decreased, impaired sense of secretion of insulin resistance also occur, and increase susceptible to type 2 diabetes mellitus and leads to obesity, metabolic syndrome, peripheral vascular diseases, and that leads to increased risk of hypertension, increased BP and myocardial infarction, and that ultimately leads to the stroke. These are other deficiency manifestations of vitamin D. So come to the toxicity. So vitamin D is a fat soluble vitamin. So when an excess we will take, that is over ingestion of more than 10,000 units per day for long time, that leads to the toxicity of vitamin D. So, what are the features of vitamin D toxicity are hypercalcemia and metastatic calcification. So, main there are effect of vitamin D hypervitaminosis are anorexia, thirst, constipation, polyuria, followed by later on nausea, vomiting, diarrhea. The hypocalcemia is persistence that leads to the urinary stones, that is urinary lithiasis, metastatic calcification, that is which affect the different distant organs like kidneys, bronchi, pulmonary alveoli, muscles, arteries, and gastric mucosa, and also finally leads to the renal failure. So come to the vitamin K. So vitamin K is also fat soluble vitamin. So this is the only one fat soluble vitamin which act as a coenzyme. So other fat soluble vitamins will not act as a coenzymes. So B complex vitamins are act as a coenzymes, but in fat soluble vitamins only vitamin K is act as a coenzyme. So vitamin K name derived from the coagulation. So here K in a German they used K instead of C. So coagulation vitamin. So vitamin K is required for coagulation. Vitamin K is a group of structurally similar compounds which contain naphtha-quinone derivatives with long isoprenoid side chain. So there are three different forms of vitamin K is available. So one is vitamin K, that is phylloquinone with 20 carbon isoprenoid side chains. So vitamin K is present in plants. So come to the next one, vitamin K2, that is menaquinone, which contain 30 carbon isoprenoid side chain. So vitamin K2 is produced by the intestinal bacteria and also found in animals. So vitamin D3 is menadione, which is a synthetic form of vitamin D, which is used as a prophylaxis to the infants. We will give menadione injection, vitamin K3, to the premature inborn babies. This is the structure of vitamin K1, K2, K3, that is phylloquinone, menaquinone, and menadione. So vitamin K2 and K1 contains isoprenoid side chains, which is shown in red color with 20 and 30 carbons. So what are the sources of vitamin K? That is greeny leafy vegetables are the main sources of vitamin K. That is spinach, asparagus, broccoli, and beans, and any other greeny leafy vegetables. So what are the other sources of vitamin D are soya beans, eggs, strawberries, meat, and fish oils will contain vitamin K. But here vitamin K can be synthesized in the body by the bacteria, intestinal bacteria. So we don't need that much of vitamin K through the diet. So come to the absorption, storage, and excretion of vitamin K. Vitamin K is absorbed from the small intestines, which require bile salts like other fat soluble vitamins, and also stored in liver, but not appreciable amount. So in the blood, vitamin K transported along with the lipoproteins. So this vitamin K can cross placental barrier and available to the fetus. Vitamin K is not excreted in the urine or bile, but feces contain large quantities of vitamin K because of mainly the bacteria can synthesize vitamin K. So what is the RDA for vitamin K? That is 50 to 100 milligrams per day which required vitamin K, but in the normal diet usually available. And also intestinal bacteria can synthesize which will meet the daily requirement of vitamin K. So what are the biochemical functions of vitamin K? So main function of vitamin K is required gamma carboxylation of these proteins. So the main function of vitamin K is K for coagulation. So certain clotting factors which required for coagulation are proteins are gamma carboxylated. So calcium can only bind after gamma carboxylation of specific glutamic acid residues in these proteins. So these factors, coagulation factors, which are the proteins which contain amino acids. So in amino acid, glutamic acid is one of the amino acid which is gamma carboxylated, means at the gamma position of carbon which carboxylated, means extra carboxyl group is added. So carboxyl group is negative, so this carboxyl group will bind with these extra carboxyl groups will gives the extra negative charge, and also will gives the combine with positively charged calcium. Thus calcium binding will require for coagulation. So vitamin K2, that is reduced form of vitamin K2, act as a cofactor or coenzyme for these carboxyl reactions. So vitamin D dependent proteins like clotting factors, factor 2 prothrombin, factor 7 proconvertin, factor 9 thromboplastin, and factor 10 Stewart factor, and protein C and protein S. So these are the vitamin K dependent coagulation factors. These are gamma carboxylated and bind with the calcium in order to bind with the platelets and for formation of coagulation. So here you can see, so first one, this is the structure of, there is a amino acids glutamate present in the precursor of clotting factors, that is 2, 7, 9, 10. So these 2, 7, 9, 10 they are synthesized as proteins or zymogens. After synthesis of these zymogens like 2, 7, 9, 10, there is will gamma carboxylated. So this is the gamma carbon of glutamate, their extra carboxyl group is added, so which require vitamin K, and carboxyl group is carboxylase as an enzyme which require oxygen and carbon dioxide. This is a post translational modification. So this will again we'll discuss on next classes, that is post translational modifications, how the occurs, what are the other post translational modifications. So here you can see, so prothrombin is the clotting factor which is gamma carboxylated. Here a COO, that is carboxyl group, and this is the another carboxyl groups which gives the negative charge which bind with calcium, that is positive charge, and will bind with the platelet membrane with phospholipids that ultimately leads to the coagulation of blood. Along with coagulation, this vitamin K is required for the functional activity of osteocalcin which is present in the bone, which is synthesized by the osteoblast. In a small protein, it is a small protein binds tightly to the hydroxyapatite crystals of bone. This binding depends on degree of gamma carboxylation. So this gamma carboxylation also require vitamin K. So Osteocalcin also contain hydroxyproline. So along with vitamin K, this osteocalcin which require vitamin C and vitamin D. So along with the blood clotting and formation of bone, this vitamin K also role in oxidative phosphorylation. So it acts as a cofactor in oxidative phosphorylation. So dichromyl, which is the antagonist of uh, vitamin K, is the known as the uncoupler of oxidative phosphorylation. This is a vitamin K cycle. So here first one is this is the gamma carboxylation occurs. This require in previous reaction we discussed. So glutamic acid present in the clotting factors will gamma carboxylated, which require oxygen and carbon dioxide and vitamin K as a coenzyme. So reduced vitamin K, that is hydroquinone form of vitamin K, is used in this reaction, which is formed to epoxide form of vitamin K. Then so this epoxide form of vitamin K is oxidized to oxidized vitamin K, that is quinone form, which require epoxide reductase as enzyme. Then vitamin K is regenerated to hydroquinone form by the vitamin K reductase enzyme, which require NADP and NADPH as a coenzyme. So at the epoxide reductase enzyme, which is inhibited by the warfarin and dichromyl, these are the structural analogs of vitamin K. So this is the competitive inhibition of vitamin K. When the enzymes chapter, just remember this is the structural analog, that is competitive inhibition of enzymes. So this epoxide reductase enzyme is completely inhibited by the warfarin dichromyl. So this the vitamin K cycle. So what are the deficiency manifestations of vitamin K? So in adults, the dietary deficiency of vitamin K is rare because intestinal bacteria which synthesize, which meets the requirement of vitamin K, and also can occur in condition of, but in malabsorption of lipids, obstructive jaundice, chronic patients and sprure, vitamin K deficiency may occur. So and also prolonged antibiotic therapy. So whenever we take more antibiotics medicines, will lead to the kill the bacteria which is present in the gastrointestinal tract, and any gastrointestinal infections with the diarrhea will destroy the bacteria, that is bacterial flora, that is the normal flora present in our gut or GIT, will ultimately lead to the vitamin K deficiency. In children, mainly in newborns or premature infants, the newborn have sterile intestines, means they don't contain any bacteria. So lack of the bacteria will synthesize the lack of vitamin K. And also in premature infants and in infants newborns, because of human milk will contain traces of this vitamin K, will provide only 1/5 of daily requirement of vitamin K. So the deficiency manifestation of vitamin K is hemorrhagic disease of newborn, mainly in the premature infants. Because of newborns and premature infants, there is lack of hepatic stores, that is liver is store is less and limited oral intake, and also absence of intestinal bacterial flora that ultimately lead to the vitamin K deficiency. So that's why in premature infants and newborn advised to give 1 milligram of menadione, that is vitamin K3, as a intramuscular injection. So in children and adults, vitamin K deficiency may lead to the bruising tendency and mucous membrane hemorrhage, post-traumatic bleeding, and internal bleeding. So these are all the blood clotting defects. So in vitamin K deficiency, increased prothrombin time is seen. There is and also delayed clotting time. But in prothrombin time also increased in liver diseases due to the deficiency in synthesis of coagulation factors or clotting factors. So we should analyze this condition before undertaking any surgery on jaundiced patients or liver. Prothrombin time before and after administration of vitamin K should be done. So warfarin and dichromol, these are antagonists of vitamin K. They are widely used as a anticoagulants for therapeutic purpose. So when they give this warfarin and dichromol to the pregnant woman, this will lead to the fetal bone abnormalities, that is called fetal warfarin syndrome. So come to the toxicity of vitamin K. So increased vitamin K leads to the hemolysis, hyperbilirubinemia, kernicterus, and brain damage. And also prolonged administration of large doses of vitamin K leads to the hemolytic anemia and jaundice. So the infants, due to the toxic effects on the membrane of red blood cells, therefore it is no longer used to treat vitamin K deficiency. Thank you.